Welcome to this teach out on Puerto Rico. My name is Perry Sampson. I'm a professor in the College of Engineering in Climate and Space Sciences and Engineering. And I'm joined today by SueAnneBell, who is an assistant professor and a nurse practitioner in the School of Nursing. And SueAnne has the experience of being called to go into natural disasters and as part of that also providing help and support to those who are affected. So let's begin, because I understood you were sent to Hurricane Irma in Florida, and then you were located in Orlando as part of that. And then Hurricane Marie came through the Caribbean and was headed for Puerto Rico. At what point were you then told to go or deal with Puerto Rico?
So my role is I'm a nurse practitioner on a federal disaster response team through the U.S. Department of Health and Human Services. And I take call about 4 times a year. My call rotation came up when Hurricane Irma struck. And I was initially in Orlando while the damage assessments were being done, and then I went further into South Florida to actually provide clinical care. And towards the end of that, it was about 2 weeks, the response was slowing down, and the work we were doing, we were seeing a fewer amount of patients, and the health system was stabilizing.
This is in Florida?
This is in Florida.
Yeah.
This is in Florida. And I expected to receive orders that, my commitment was over and that it was time to go home. But that around the time we were wrapping up was when it looked like Maria was going to be a very significant storm and was headed towards Puerto Rico. And I was asked to stay for an additional period of time. And then I spent several days staging while we were waiting for Hurricane Maria to hit follow its path, and then while the initial damage assessments were being done. And then I ended up going to Hurricane Maria several days after the storm.
All right, so several days, the storm has passed Puerto Rico. I'm presuming by the time you get there, you already know that things are not good.
Right, definitely.
And when you get there, what exactly did you do there in Puerto Rico?
So we knew that things were not good, but we didn't have a lot of information. We were getting, sort of spotty reports, and, information was still being collected. So really, I didn't know what to expect. However, one of the central tenets of disaster response is all hazards preparedness, which means that if you're going in, you need to be ready for whatever comes your way. So while we were staged, we spent a fair bit of time figuring out, bringing a supply of food, water, everything we needed to be self-sustaining for. We expected about 3 days we needed to be self-sustaining. We were issued MREs, or meals ready to eat.
Can you describe what those meals were like?
Sure. And that's a good question, because part of being in the field is a lot of really uncomfortable conditions that are, have a fair bit of stress for the responder, in addition to the work that they're doing or that we are doing. But an MRE is a military food ration that it provides and should provide enough calories that one person needs per day, and it's shelf-stable meals that can last, for decades. It comes with a little heating pack, and it was often something like beef marinara noodles with crackers and peanut butter and a little tiny piece of gum.
I'm going back to the beef marinara.
Yeah.
You said you're in a disaster situation. I'm just stupid here. How do you keep that?
Well, it's shelf stable, so designed to last for decades.
Okay,
so you open up the package,
Sure.
and there's a small heating element that
Gotcha,
heats it
gotcha.
for you, so you can have a hot meal. But is it palatable? Not really.
Well,
It provides
fair,
calories.
yes, that's your
Right.
goal at that point. So you are in a building? You're in a tent, or how do you function in the disaster zone?
In this particular setting, I was in 2 different settings around Puerto Rico. The first the first portion of my time, we stayed at the main convention center in San Juan, and were issued a small cot and slept in the convention center in a room of about could hold about 400 or 500 people. So all our bags, all our supplies, and a small cot, and in a room I shared with 400 people.
Mm-hmm. And there, what was your experience with electricity? I would like to believe that people in your position must have generators or something to support yourselves, so there was enough.
There was power in the Coliseum. However, we went out into the field, and for that portion of my work there, we set up an FMS, which is a federal medical station, and that is through the Centers for Disease Control Strategic National Stockpile. Mm-hmm. They will send a container containing everything you need to set up a 150-bed unit to take care of less serious illnesses, including inpatient. Mm-hmm. So we went to a Coliseum about an hour outside of San Juan, into a Coliseum with no electricity and no running water, and also no food, and a huge number of giant boxes, maybe 300, and we set up that from scratch. Opened a box and saw, okay, this has stretchers, and we opened the next box and saw this has IV poles. So over a period of about 2 days, we assembled that entire thing, and we're ready to see patients.
Now, you wear multiple hats, Sue-Ann, and you're a faculty member, so you're doing research, and your research is on how people are affected after the event because of lack of medical care, et cetera. You're also a member, as you've mentioned, of this federal disaster response team, and you're an advisor to FEMA. Let's start with the last one first. With FEMA, recently came out with a report about, basically a self-report on how they did in Hurricane Maria. You've seen this report, I presume. Do you agree with the assessment that the government may not have done as much as it could have?
I would agree with that, and I would say that while it was fairly self-critical, some of those criticisms were warranted. There were also some things in it that are relevant for future disasters. And one central saying in emergency management and disaster response is all disasters are local. And in the initial response period, it really is up to whoever is on the ground then to do the initial work in the response. And that can be a challenge in a resource constrained setting.
That's a good point. So we had a number, obviously, of hurricanes that happened in 2017, affecting Texas and Florida, as well as Puerto Rico. Puerto Rico has the additional constraint that it's an economic constraint, really, where they were in a state of they weren't strong, let's say, economically, and so maybe less prepared. So you're saying that probably played a role in the fact that the initial response locally couldn't be as strong as you might hope, and then the federal government came in and was ill prepared, maybe, to.
I think that there were a number of factors that made this a huge challenge, and part of that is that it's a small island where everything needs to be flown in or shipped in, and when the major sources of the telecommunications and when everything is down, trying to figure out what those supplies are and where those supplies need to go without communication, it's a big issue. And that would be an issue for sort of any island. But this after action report, at least there's something that we can learn from, that if in the event that we have a huge major disaster that affects, offshore or island, then we will be better prepared to address it in the future. And I guess that's the point of an after action review is to learn from it.
Yes. And I understand that you are supported on Puerto Rico by, I'm presuming, the military was also part of this?
There was a big military presence there as part of the response.
Sure. And were there hospital facilities that you could go to or to lean on for additional support, or were they all limited by the power outages or other reasons?
There were definitely open and functioning hospitals that were working to the best of their capacity, whether it was by generator or by flashlight, or without running water, or if they were closed completely. So there still was healthcare being provided, but to say that it was cobbled together would be an understatement.
So when you're in Puerto Rico, you were supported by multiple groups, presumably,
Right.
including the military. And the military did provide a ship, the Comfort, which was on shore eventually. To what degree did that help your effort on Puerto Rico?
So I mentioned that I was working with a federal medical station, and that was the initial part of the month I was in Puerto Rico, and the second part was supporting the U.S. Navy ship, the Comfort, and so I worked in tents outside of the Comfort, providing clinical advanced practice nursing care, and it was an intense, busy experience. I worked from 7 p.m. to 7 a.m. and was constantly busy the entire time with a number of different health complaints from people who were there because they couldn't find care anywhere else.
Can I just jump in here?
Sure.
You, I presume, have been responding to a number of these disasters over time. How did this experience in Puerto Rico compare? I mean, was this on the scale of other disasters, or was this in some ways, in your mind, greater?
This was huge. It was really huge. Conditions were really a challenge for the community there. And it was not something that we should have happen in the United States and its territories. What happened in Puerto Rico should not have happened, and hopefully will not happen again. And
you were telling me before some stories about the children coming to the clinic who were having trouble breathing, asthma, etc., and how hard it was to find support for these children. Part of that's probably to be expected when you're in an emergency situation. How could we have done better, in your mind? What more would have made this less traumatic?
I think on a larger level, there needed to be better communication between federal, local, and the private sector, and that just wasn't in place. I think that there were a number of different entities that were working hard to, address issues with very limited resources. But there was often a lot of disconnect. So, for example, when we wanted to send a patient to the main hospital or any hospital, for example, often those hospitals would be completely overwhelmed and for very valid reasons would say, you got to send them somewhere else, we're at capacity. And that was just because of kind of the huge volume of patients needing care. Like if you can imagine being in Puerto Rico where, it's hot, you've been days without air conditioning, you're eating food that maybe you got from a restaurant or the corner store, but you don't know the origin of, was that refrigerated or not? So you get, some stomach trouble from that. And then you go to these federal healthcare facilities and wait for hours and hours and hours.
I want to go back a second because it's understandable, Puerto Rico being an island and all the food has to be brought in, all the supplies need to be brought in from away. That's understandable, but the part you mentioned that the lack of coordination between groups, isn't there a plan in place? And I would imagine in most coastal regions there'd be some plan for how do we respond to a storm like this. So you're just saying that failed, or it just wasn't there? I
wouldn't say that it failed, and I wouldn't say that it wasn't there. But I think no one expected the huge. No one expected that storm would hit Puerto Rico. If they had expected it, then as we saw in the FEMA after action report, they cleared out their emergency supplies and sent them to the Virgin Islands because, per the report, that was where the expectation the damage would be worse.
Yeah.
So we're sort of already starting from zero there. But there are plans in place, but no two disasters are the same. So you never know. You have your plan in place, but it's always the best laid plans. You never know what's going to happen. And then getting resources in was an issue. Telecommunications or communications in general were an issue. It was hard to figure out what roads were open because there wasn't communication. And all that took a long time, and it took longer than it should have taken.
So we sort of talked about your role with FEMA and assessment of, how do you know whether you're successful or not is part of that effort. We've talked a bit about your role with the Federal Disaster Response Team and the work you're doing in the field. But the majority of your time is here at the university doing research on how extreme, how disasters like this affect people after the disaster. So I'd like you to think for a moment about how that's maybe affecting the people of Puerto Rico.
So I study the long-term health effects of disasters on vulnerable populations, and I focus specifically on older adults. And what I'm interested in is if we think about this death toll of 64, which clearly was asinine. I'm not sure who could have possibly believed that. But some of this larger death toll, which seems much more accurate and believable from the Harvard study, we see a lot of these deaths could be attributed perhaps to chronic disease, diabetes, or hypertension, or end-stage renal disease, where there's a breakdown in very necessary medical care that doesn't happen, that has a longer effect than we know about. So, for example, if a diabetic has extremely high blood sugar and they don't have access to the healthy foods they need to maintain their diet, then it's not just a matter of bring the blood sugar down, they'll be better. That's going to have effects for a longer period of time on their overall health.
And if we're supplying boxes of food to these people, do we take into account the fact that some people are diabetic? I heard stories.
I can attest to that the food rations we received were pretty unpalatable. An example of a shelf-stable meal, and that's definitely a consideration, is that the meals have to be shelf-stable. They have to sit in a warehouse ready to be shipped out for months and months. However, I think the meals could be better. So an example of one meal that I had was a Nutri-Grain bar, a package of tropical fruit Skittles, and a small can of hot and spicy Vienna sausages. So that's sugar and salt.
And diabetic, I've got to believe that the Skittles were not helpful.
Skittles and a Nutri-Grain bar? No way. No way.
Okay. So how do we do better? Obviously, I'm not going to sit here and denigrate the effort of many good people there in the field.
Because I agree, there was good effort by many people in the field, and I think sometimes that gets lost in knowing that the response wasn't what it should be.
Right. Well, that was needed to be a huge response, and so the bigger question is, I think we do know these hurricanes are going to hit Puerto Rico and they're going to happen again,
right?
Or Virgin Islands or wherever. So what's going to change? In your group, is there any talk about how to build a better system?
I think that it is ongoing all the time, and is an essential part of my work is how to build a better disaster response, because we learn from every disaster. But I think one big shortcoming that I am working to address is that we don't have a consistent and long-term system of collecting data that we can analyze and draw relevant conclusions from. And instead, we have this over-reliance on an after-action report or, sort of a lessons learned, which is important and has its place for certain, but isn't going to give us the data we need to make generalizable observations that we can use to make interventions for future change. And I think that might be, putting those systems of collecting and analyzing data is going to be so important in moving forward. And unfortunately, I just don't think the focus is there at this point.
And how would you do that? Is this the role where the federal government would give grants to think about?
I think that's definitely a start. Am I allowed to say it's anyone out there from the federal government?
Fun to say.
Right, right. So that's definitely a start. Is that we have to have the funds allocated to be able to do that. But there are already federal structures that do that work that could make that a greater focus. But I think one big problem that hopefully the 2017 hurricanes are rectifying is that there's a huge disaster, and there's a ton of focus on that disaster and resources, and everything goes to addressing that disaster, and then it falls out of the media, it falls out of maybe congressional focus, and that funding either goes away or isn't sustained, and then the work that's needed to be done to address the next disaster just isn't there.
All right. I'd like to thank you for coming to talk to us about Puerto Rico and your experiences with Hurricane Maria.
Thanks very much for having me.
You're quite welcome. And we invite you, the audience, to come and participate in this discussion as part of the Teach Out and offer and share your experiences with disasters and your experiences with nursing and such. How can we do more to help these people? Thank you.